Doctors and nurses of Reddit, what have been your, why didn't you come in sooner? Moments? Imaging guy here. I have a million of these. I work with vascular patients and wounds. Had a guy whose foot was completely broken sideways at the ankle. He had it still wrapped from when he left the hospital. He would use the stumpy part to move around on his wheelchair and leave little blood sponge prints on the floor. Another guy with bad ankle and foot wounds decided to stop going to wound care, and was afraid to take the wraps off even after his foot started to stink. By the time I saw him, his skin had kinda liquefied. Earlier on in my career, I saw a guy with necrotizing wounds to both legs that had eaten to muscle in multiple places below the knee. I asked him how long they looked like that, and he said about 2 years. Next time I saw him, he was bilateral above knee amp. Stump wounds. Just stump wounds. Take care of your feet, people. If you're diabetic and can't feel the bumps and scrapes, please check your feet regularly. Doctor here, might be a bit late and will probably be buried, but had a 65-year-old dude who was diagnosed with lymphoma 8 months before we saw him. He lived an hour out of the city and didn't want to drive in for treatment, so decided he wouldn't get treated at all and stayed on his little remote place in the country by himself. Essentially, because it didn't get treated, it spread along his skin, and his neighbors called an ambulance when popping in on him. It had spread so far that it essentially went from his head to his knees. It had started to invade his eyes and mouth membranes. He couldn't drink and could barely see. His skin had started to slough off, and he was so severely dehydrated because he was losing so much excess fluid from his open skin that we had to treat him like a severe burns patient and had plastics involvement. The consultant said if he had received treatment, there was a chance he could have recovered. Instead, he died 3 weeks later. Former medic here. Called to a patient who had cut their leg while chopping wood about a week prior, and now it was really itchy. Old gentleman, didn't drive, lived alone. Got to his house, unwrapped the ungodly swollen leg to find that he'd tried to superglue the wound closed and maggots had commenced to growing inside. The itching he was feeling was the writhing maggots under his skin. On the plus side, the maggots likely kept him from developing sepsis. True. I was just expecting dry skin or something. Not, attack rice. Okay, I'm not a doctor, I'm the idiot who didn't come in sooner. When I was a teenager, I thought Converse were the shit, even though the pair I bought were pretty cramped in the toe. I used them all the time for PE. Here is where things started to go wrong. I started getting an ingrown toenail, and instead of taking care of it, I just tried to cut the nail out and end up with this puffy red angry shooting pain in my toe. Then I noticed some wetness in my shoe. It's puss. What do I do? Buy a new pack of socks for the next 2 weeks. Week 2, I wake up and my foot is on fire. I look and it was half red, half purple, and puffy to the touch. I go into urgent care with my mom, who I don't show her the foot, just that I think I need it looked at. Doc comes in. Yeah, I'll take a look, but we don't do ingrown toenail extractions. I'm sure it's not that bad. I take off my shoe. The smell. My mom turned white and had to sit down as she fell into a literal litany of non-stop prayer. Doctor says, that is the most infected thing I've seen in the last 10 years. I'll grab the kit. We need to get this toenail out and put you on serious antibiotics now. Don't foo *K around with ingrown toenails. ERPA here. The worst I ever saw was a man in his 50s who was an alcoholic and had anxiety problems, who was brought in by his neighbors for a facial infection. Turned he had squamous cell skin cancer that made the left side of his face look like the Batman villain Two-Face. The CT of his face and neck revealed that it had spread into his lymph nodes and mandible. The skin on his face was literally sloughing off as I spoke with him, and the smell was absolutely horrible, and I smell terrible things all the time. I have never almost vomited in a room except for him just due to the smell. I asked him why he waited, and he said he was just terrified of doctors and hospitals, and I believe him. He was extremely anxious the entire time he was in our ed. His neighbors were saints. They said they had been trying to get him to the hospital for months, but he wouldn't come in. We transferred him to a tertiary hospital with ENT and cancer specialists. When I checked his chart a few days later, they basically said he was terminal. I'm still just a nursing student, but my professor told us a story of when he was an ER nurse. An elderly 80-something-year-old woman came into the ER, and as he assessed her, He noticed her oral temperature was normal despite her neck being extremely hot to the touch. He decided to take a rectal temperature, which ended up being like 103 or something crazy. While he was down there, he noticed something peeking out of her vagina and proceeded to remove it. It was an old sock. She said her uterus had prolapsed months before and she was using the sock to keep it in. They began treating her for TSS immediately, but sadly she went septic and died later that day. Tongue-in-cheek, he told us she died of toxic sock syndrome. Weary face skull nurses have to use dark humor to cope.